Hello guys, I hope you're okay. So let's look at clozapine. So if I'm not mistaken, clozapine is a very, very dreaded word. Now why? Because antipsychotics themselves, I feel like with students taking the Gphc exam, is a topic that people tend to neglect. Now, even though obviously this is the wrong strategy because antipsychotics are important, let's quickly go through some facts about antipsychotics. So antipsychotics are available as oral preparations or depot injections, right? So second generation antipsychotics have fewer EPS than first generation antipsychotics. That's the first point that I want students to know. So second generation antipsychotics have fewer EPS side effects than first generation antipsychotics. And that is a very, very crucial point to understand. So oftentimes in the Gphc exam, they will ask you which antipsychotic causes this. So second generation antipsychotics are associated with weight gain, glucose intolerance, and hyperprolactinemia. So second generation antipsychotics are atypical, right? So I want you to think of atypical because they're atypical, so not normal or not typical, they will cause more ADRs, or they will cause metabolic disorders. So they will cause weight gain, glucose intolerance, and hyperprolactinemia. So second generation antipsychotics have fewer EPS than first generation. However, second gen antipsychotics have more metabolic disorders, such as weight gain, glucose intolerance, and hyperprolactinemia. And that is a very, very important point to discuss today. Very, very, very important. So the GPC loves to ask which drug is associated with weight gain. You might get it as an antidepressant, you might get it as SSRIs. For example, mirtazapine is associated with greater weight gain, for example. So this is the first point. And we've also said that antipsychotics are available as oral preparations and depot injections. And sometimes in the exam, they will ask you, okay, so why is it that you'll use a depot injection rather than oral preparation? And it's to do with adherence and compliance, actually. So this is very, very crucial. And when we talk about hyperprolactinemia, what do we mean about hyperprolactinemia? It's talking about galactorrhea and breast enlargement, which can happen in hyperprolactinemia. So there is no first-line antipsychotic drug suitable for all people with psychosis, except for clozapine, right? But the issue with clozapine is you need specialists to make a informed decision whether it's suitable for the patient. Clozapine is generally offered to people who do not respond adequately to two other antipsychotics. So patients that do not respond to two different antipsychotics, can be initiated with clozapine and monitored in secondary care. So clozapine is given to patients who have already tried two different antipsychotics. And this must be done under secondary specialist care. And you have to be careful with clozapine as there are lots of monitoring points, because we have to bear in mind that a lot of antipsychotics can cause cardiovascular issues, right? Very, very important. So this is crucial to know. So antipsychotic depot injections are used for maintenance therapy when adherence to oral treatment is unreliable. They are administered every 1 to 4 weeks. And first generation antipsychotics primarily work by dopamine 2 receptors in the brain. So first generation antipsychotics are thought to primarily block dopamine 2 receptors in the brain, which is very important. So typical antipsychotics mainly exert effect on dopamine 2 receptors. So you can imagine the atypicals are more generalized, like TCAs in depression. And thank you so much.